major component of anatomical terminology are terms of relationship, often described as directional terms. And some of these are going to be found in pairs. Now, the terms could either be used as a pair with one term relating to another, or used independently in some cases. And the idea is that these directional terms or terms of relationship will better help us relate one structure in the body to another. For example, if we were to look at the terms superficial versus deep, we would describe structures that are located closer towards the skin or the surface of our body as being superficial, while those that are directed or further away from the skin are going to be termed deep. So we're going to see that we will have some structures that are going to be more deeply located and some that are more superficially located. A good example of this is the venous system, where we're going to have some veins that are going to be more superficially located and course through the just hypodermis or subcutaneous tissue, while we're also going to have some deep veins that are going to course deeper to other structures. We could also simply describe these structures in relation to one another with these terms. So I could describe the muscles of the arm as being located superficial to the underlying bone, or I could describe the bone as being deep to the overlying muscles. So the terms are going to be helpful for identification and relationship of one thing to another within the body. Another example of this are the terms anterior or ventral and posterior or dorsal. The anterior or ventral surface of an organ or the body is towards the front, while the posterior or dorsal is towards the back. And you can help remember the term dorsal or back by thinking of the dorsal fin of a dolphin or a fish, which is located along the back of that animal. So the posterior surface or anterior surfaces could also describe an individual organ or a compartment within a region of the body. For example, there are muscles more anteriorly located and those more posteriorly located. We can also describe structures as either being superior or cranial and inferior or caudal. Cranial means the head, while caudal means the tail. So structures that are more superior are closer towards the top of our head, while structures that are more inferior are further away from the top of our head or closer towards the tail, or you could think of it in us as towards the soles of our feet. Now we could describe the eyes as being superior to the oral cavity, or I could describe the chin as being inferior to the oral cavity. The terms superior and inferior often are going to be applied to the trunk or the structures within the midline of our body, also including the head and the neck. While in the limbs, we might use directional terms of proximal and distal. A proximal structure would be closer towards the point of origin, while distal is further from that point of origin. So we could describe the elbow as being either proximal to the wrist, or the shoulder as being proximal to the elbow, or we could describe the wrist as being distal to the elbow. We could also use these terms proximal and distal with some of the hollow organs of our body, like those found in our digestive tract, where the stomach would have a proximal end and a distal end, as would the small intestine and the large intestine. So the points being closest to its point of origin would be proximally located, while the distal is further from that point of origin. The last terms I'd like to describe are related to the midline axis, and these are going to be the terms lateral and medial. In anatomical position, I would describe our thumb as being lateral to the little finger or the pinky, which would be more medially located. And this will be helpful as we look at some of the large structures in our body where they may have in their name the terms medial or lateral, again in reference to the mid-sagittal plane in the midline of our body.